I'm Brian.
How old are you, Brian?
38.
Alright, so let's talk about why you're here today.
Well, I've been experiencing regular cramps, twitches, and sometimes it's difficult to swallow. Because of my throat's muscles feel weak.
Alright, let's take a look. I'm going to have to ask you to stand up, sir.
Alright.
Alright. Over here, say ah. Ah. Very tongue, nice and wide. Alright. We'll check your ears. Okay, nice build. Alright, now, we can have a seat for this if you'd like.
Alright.
I want you to grab my hand and squeeze it as hard as you can. Alright, other hand. Okay, now just stick out your arms, please. Alright, now push down as hard as you can. Alright. So, to me, it looks like this could be the beginning of physical symptoms to a disorder called Amytrophic Lateral Sclerosis, ALS. Have you heard of this before?
I've heard that Stephen Hawking has it.
Yes, that's right, and also the baseball player Lou Gehrig. Tell me more about what you have been experiencing. Have you been feeling anything else?
Well, I've been having some general weakness in my right arm. Other than cramps in my throat, I'm fine physically.
Twitching and weakness in the muscles on one side of the body are consistent with ALS. How about your psychological condition? Anything going on there?
No, I don't think so.
Alright, this is matching up. ALS shouldn't affect your comprehension and thought, so you shouldn't be experiencing any mental or behavioral symptoms.
Okay, is this disease pretty bad?
I'm afraid so. However, let me inform you as much about your possible disorder that I can. ALS is a motor neuron degenerative disease, which basically means that your brain slowly loses the ability to control voluntary muscle movement.
Is this a genetic thing or what?
Well, studies say that a range of around 5 to 20% of cases are hereditary. There are lots of different forms of mutations on varying chromosomes. But the most common form is on chromosome 21, where there is a mutation that stops the production of the enzyme superoxide dismutase. This is an antioxidant that protects the body from things called free radicals, which kill cells. Do you know if any of your family had ALS in the past?
No, I don't think so. What are the other causes?
That's the kicker. Around 95% of ALS cases have unknown causes. Some inconclusive research states that some potential causes are head trauma, military service, and/or participation in contact sports. Can you associate yourself with any of this?
Well, I played high school football, but I stopped my senior year because I got a concussion. Wow, this is pretty bad. Is that really how I got it?
Well, we can't be sure because we don't really understand who is susceptible to ALS and whether genetic or environmental factors cause it. However, men get it more often than women and are often diagnosed usually at around age 40.
Really? Wow. How common is it?
According to the ALS Association, around 30,000 Americans have ALS at any given time. ALS is very uncommon.
Man, well, how can we treat ALS?
Well, there are several treatment options to slow the progression of ALS.
It's a muscular thing, right? Would physical therapy work?
Exactly. Physical therapy can help strengthen unaffected muscles and relieve muscle tension. Speech therapy may be helpful as well when the throat muscles start to get numb.
Alright, well, what is the direct cure?
The drug Lateral is said to lengthen survival by a few months. Other than that...
Is there no cure?
I'm afraid that's correct.
All we can do is slow the progression?
Yes, but there are things that can help. The ALS Association can find you support groups and local clinics for ALS patients. Check out their website at alsa.org. All of the specifics will be here. I think this may help. Take a look at that.
Well,
yeah, the ALS Association also has been conducting further research into the genetic causes of ALS. With science moving as fast as it is, we can hope to get better treatment options and even a cure.
Well, I guess I'll be studying a lot more in the future.
I believe so. Take care, Brian.